You're watching Pyro Media Network.
I gotta tell you something I could do. I could be running around chasing you, but I won't. Cause I got better things to do. Rather spend my precious time chasing somebody who loves me too. If I got $1 for every time you slam the door, I would be the richest girl alive. If you hadn't run away every time I asked you stay, you would sleep right next to me tonight. But you didn't know me, all you wanted was a game to play.
Hello, Pyro Media family. Thank you for tuning in. If this is your first time joining us, welcome. We hope your experience with us is fruitful. While we are loading your experience, please do us a quick favor and hit that like button from whichever platform you're watching or listening on. And we do hope you consider hitting that subscribe or follow button so you can check out more of our amazing content. All right, let's start the show.
Hey, happy Friday Junior. Happy Halloween. If you celebrate, I'm reached that age. Halloween really doesn't really mean much to me. When my kid was little, it did. But anyway, happy Friday Junior. Happy Halloween. Happy end of October, beginning of November. I am Nicole D. Vick, Dr. Nicole D. Vick of Nicole D. Vick Live. Really happy to have you all here tonight with me. I have a special guest, really excited to bring her on. Now, this month I have been talking about all things healthcare. Your girl had a healthcare incident over the summer, and it has taken a long time to get to where I am today. I'm still not 100%, but I'm on my way, and I'm really excited about that. But when this happened to me, it really made me think about, wait a minute, what is going on with the healthcare system in the United States? And we've talked about open enrollment, how to pick insurance. We've talked about the emotional and psychological impacts of being ill or injured. We've talked about all sorts of things. And I want to close this month out to kind of take a broader, bigger picture look at the state of Black Californians in regards to their health and really delve into this issue of healthcare access, health inequities, health disparities, and just really dig in and kind of look at it from a larger, broader perspective. So as you know, we're going into election season. Not going into, we right up in the middle of it, but election day is coming up. And, Halloween is today, but I'm actually more scared of what's going to happen on election day than I am of what's going to happen today. Did that make sense? I'm more scared of what's happening to Black Californians in regards to their health than I am scared of Halloween right now. So there's a whole lot of things that are happening, and hopefully we will even get to touch on the political aspect of healthcare, right? How the election has impact on how people access healthcare. So without further ado, I just want to go ahead and bring on my guests, because I think we just really need to just start this conversation and jump right in. But thank you all again for being here. We're going to talk about the access gap, specifically amongst Black Californians. I'm here in Los Angeles. So a lot of us here in Los Angeles and in California. And I want to kind of hear about what this particular organization is doing, what we should be doing, and what we should be thinking about after the election. All right, I have a special guest, Miss Rhonda Smith. Can we please bring her on?
Hi, Nicole.
Hey,
How are
Rhonda,
you?
how are you?
So I wanted to say, let's hope that Tuesday night is not the real fright night for us, right?
You don't
Yeah.
listen.
Yes.
Because this,
Yeah.
'cause this right here is child's play, but Tuesday could really, yes, you're right, could really be scary for a lot of us. And I'm really, really worried. But before we dig in, because we can jump right in, I want people to know who you are. You are the director of California Black Health Network, yes, but who are you? Because I feel like I know you, but I don't know you. Like, tell us some background, who you are, and why you do this work.
Yeah. So first of all, I am definitely an East Coast girl. I am from Virginia. I was born, bred, and educated in Virginia, but spent most of my adult life living up and down the East Coast. As you probably know, I moved here from Miami about 11 years ago, and it was in Miami where I started this journey, really. I was self-employed for about 20 years prior to joining CBHN. The first half of that, I say the first half of that was working in corporate, doing corporate consulting. And then in 2008, I was diagnosed with breast cancer, and then the economy tanked, and it put me on a different path in my life in a lot of different ways. And so obviously my health care issue caused me to think about life in a different way and how I wanted to, should be, needed to live my life. And so I didn't necessarily want to travel every week, live out of a suitcase and in hotel rooms, and wanted to do something that was more purposeful, and I was passionate about, and didn't seem so much like work, but more of an extension of how I live my life every day. And when I started to find the answers to those questions, I realized that I was being asked to talk to women who were at various stages of their breast cancer journey. And I really enjoyed being a partner to them, no matter where they were, in their stage of their experience. And so I thought about, like, what could I do with this? And how could I maybe transform what I was doing before into a new kind of business? And so I started a company called Breast Cancer Partner, which focused primarily on survivorship consulting. And I curated health and wellness education experiences for women to really help them understand how to recover from breast cancer treatment, how to restore their lives back to normal, and then get re-energized in living their lives well beyond breast cancer in a more holistic way. So I started doing that on my own, and then had the opportunity to work as a consultant on a NCI, that's National Cancer Institute funded research study at the cancer center where I was treated, to really understand the impact of health education and wellness and stress management on the population of Black women in South Florida. I say very diverse population of Black women in South Florida. And it was through that experience that I actually got exposed to, became aware of health disparities. And I say at first I got really pissed off about it. Secondly, I wanted to do something about it, and unfortunately couldn't find opportunities in South Florida. So I had a relative who was, influential in my decision to move to California. So 11 years ago, I uprooted my life and moved to LA. I say to pursue my dreams, but not in entertainment and other aspects of life. And so it was, moving here was the best decision I could have made to do the kind of work that I really believed I wanted to do. My first project here was being the statewide director and consultant for a breast cancer disparities initiative, working with the 7 Susan G. Komen affiliates that were in place at the time. So that was called the Circle of Promise. Don't know if you heard about it or remember it from way back in the day, but we really focused on making sure that Black women had access to screening. So we literally met people where they are, where they live, where they work, where they played, where they worshiped. And one big thing that we did was organize mobile mammography events all over the state. And so we did them at churches, we did them at grocery stores, we did them at housing complexes, we did it at KJLH Women's Health Expo, wherever we could find Black women, to give them access to free mammograms. Because we know that is important for women to be more compliant with their annual mammograms and make sure that there's early detection should someone receive a cancer diagnosis. So that kind of me in a nutshell. But, you know, personally, I'm an only child, but like I said, I'm a East Coast girl through and through for sure.
We will forgive the East Coast girl through and through because you've made your way over here to the best coast, and that I'm happy for that. And you know, one thing that as I was listening to you, it sounds a lot like what a lot of us end up doing. Something happens to us, or you know, we experience something, and we take that and we say, how can we use that to help someone else? And I really feel that that is such an important strength. I think specifically that Black women own. Like we don't a lot of us don't gatekeep. So if we go through a thing, we want to make sure that other people don't go through the thing the way we did. We want to help them navigate. And I really feel like that's just something that is so important for us and really instrumental in making sure our communities are healthy. You also talked about access, and we're going to dig into that a little bit more, but you know, the disparities in access, the disparities in getting mammograms and having these things to figure out how to navigate your own health. So important and a lot, very much needed in our communities, but often they're not there. So I'm really intrigued and interested and happy to hear that, you know, you were able to do so much with what happened to you, because you could have said, oh my gosh, this is horrible, and just kind of just brushed it off and I don't want to talk about this. I don't want to deal with this. But you said, how can I take this and use this as the catalyst to move forward to help others? And I think that is so important. So one of the things when I first met you, and when we met, it was the interview for me to get on the board. So this disclosure, everyone, I am on the board of California Black Health Network. I was surprised. I think I had heard of the organization, but I did not know CBHN was 40 years old. Can you talk a little bit about what the California Black Health Network is, what it does, and you know, just share that, because I think we need to kind of have that base level of information as we move forward in this conversation.
Yeah, absolutely. So actually, the California Black Health Network was founded in 1978. And we officially became a 501c3 in 1983. So last year was the 40th anniversary of us officially being a nonprofit. But in total, the organization's been around for about 46 years. And from the very beginning, you know, it was intended to focus on improving the health and well-being of Black Californians. And over the 4 decades or so, that has happened in a lot of different ways. You know, a lot of the work that we're doing now is really focusing on empowering our community to be more proactive and take charge of their health and well-being through the How Do I campaign, which we'll talk a little bit about shortly. But, you know, just generally speaking, we do this work because we know that Black Californians live about 6.5 to 7 years less than everyone else in the state on average. You know, if you were to look closely and disaggregate that, you know, with other populations, that life expectancy gap gets even wider. So we're unfortunately dying from things that are for sure preventable, that we shouldn't be dying from. And so as part of the work that we do to, you know, with a California Black Health Network, is to try to close that gap and work at the individual, community, and system level to really improve life expectancy of Black Californians.
Yep. So CBHN is the same age I am. Yay, because I was born in the same year. So it's kind of cool to kind of put it in perspective. Like, okay, all right, we middle aged, we're seasoned, and I think that the conversation around health disparities, life expectancy differences. I remember when I first learned those things working, you know, in where I currently work, but years ago, learning about those things, it was very disheartening to hear, like, just, you know, based on your zip code, we can kind of tell how long you're going to live, right? If you live in Compton versus someone living in Santa Clarita, yeah, that's like, right, there's like a decade of difference. And there's so many things. And I remember someone put it in perspective for me. Think about what happened in your life in the span of 10 years. school, children, grandchildren. There's all these things that could happen for you, good or bad, of course. But if those years are taken away from you, what do you lose? And it's really interesting, even in the epidemiology terms. What is it? Years of potential life lost. We even try to quantify those kinds of things. And it's like amazing to understand and know that because of the way our society is structured, that some people will literally lose out from the moment they're born, they're losing, right? And then some others are very, very much advantaged and have a lot of privilege. It's so crazy to understand that. And I'm glad that we have organizations like CBHN that are trying to mitigate, right? Trying to help resolve and eliminate some of those disparities that we see, or inequities that we see in our society. We're going to actually go to commercial right now for a minute, and then we're going to come back because I have some more questions for you about the campaign you talked about. And let's go to break. Take a break, get some water.
Okay.
Are you ready for enlightening conversations that transcend boundaries? Get ready for Conversations with Clergy, brought to you by the HIV Vaccine Trials Network. In partnership with the world's largest publicly funded international collaboration, the HVTN is dedicated to evaluating vaccines to prevent HIV and COVID-19. But their impact doesn't stop there. The HVTN is at the forefront of advancing vaccinology, social and behavioral sciences, statistics, immunology, and even contributing to the research on tuberculosis and COVID-19 vaccines. By supporting Conversations with Clergy, the HVTN not only brings you thought-provoking discussions, but also contributes to the global effort to combat infectious diseases. Tune in, stay informed, and be a part of the change. Conversations with Clergy, supported by the HVTN, empowering conversations, empowering lives. Join us in this journey of knowledge, understanding, and progress. Conversations with Clergy, proudly brought to you by the HIV Vaccine Trials Network, because together we can make a difference.
And we are back. I am here with the director of the California Black Health Network, Rhonda Smith, and we have been talking about access. We've been talking about the organization California Black Health Network specifically. And I'm about to dig in a little bit deeper. So, Rhonda, you know that I had a really crazy journey dealing with healthcare over the summer, and we still in it right now. Ankle broken, 104 days from the time I broke it till the time I actually got it fixed. And I said, wait a minute, I have good government county insurance. I got to, do my job. What is going on? But it didn't matter because I still kind of got pushed along from doctor to doctor. Nobody's listening, and all this weird stuff was happening. And so it made me think, what if I did not have family to back me up? What if English wasn't my first language? What if I was neurodivergent? Can you talk about why healthcare access is so important for Black Californians? And I don't know even if access is just enough, right? Maybe we can even talk about that. But let's start there. Why is healthcare access so important for Black Californians?
So I think in terms of healthcare access, that is like the first step in terms of advancing health equity or trying to achieve health equity. But then there's access. there's utilization, and then there's navigation, right? And those are totally separate things. So we can have basic access to healthcare by enrolling or picking a healthcare plan, like we kind of talked about earlier before we began the show. And then there's, utilizing those healthcare benefits. But first of all, you have to understand, what do you have access to? What are your benefits that are part of your healthcare plan? Like, what do you have to pay for out of pocket? Like, what doctors can you see? What's a network? What's out of network? So all of those things are really important. An HMO is very different than a PPO or EPO. So you have to decide what is best for your lifestyle. Some employers only offer one option, so you may not have that much flexibility. Fortunately, we offer a cafeteria plan, so people get to choose what works best for them in terms of their options, their freedom to choose a provider in their network or out of network or whatever. So access, and then utilization, like how are we actually using those benefits? And then navigating through those benefits to know, okay, so if I need to get a mammogram, right? You can do a self-referral, right? Or you can go, well, HMO may work a little different, but you can definitely get that on an annual basis. But then what if you need follow-up, right? And sometimes if you have to get a follow-up diagnostic, if there's something that doesn't look right, usually it's an ultrasound. Well, then you may have to call and negotiate with your health insurer to make sure that gets covered, so that you don't show up and say, hey, I'm here for my ultrasound, and end up paying $800 out of pocket because that wasn't covered, right? But here in California, we have something called the dense breast law. And if you are a woman of any persuasion, that means if you are expected to receive a notification from either your radiologist or your primary care physician to inform you that you have dense breasts. And what that means is that you're entitled to get a companion diagnostic, usually a ultrasound, in conjunction with your mammogram, to make sure, because we know that mammograms are not 100% reliable when it comes to actually breast screening if you have dense breasts. And we're still in Breast Cancer Awareness Month, so that message is still important for people to know. And so you have to ask your healthcare provider about that, but there is something for sure called the dense breast law here in California and a few other states across the country. And so that's what you have access to, right? Yeah.
Right. I had never heard of that. And I think you really said what I've been thinking this whole time, that access is important, or I guess I'll say it this way, the way I was talking to our previous guest last week. Health insurance is the key to access. But if you don't know how to use, so health insurance is the key to the door to get into the access. But if the key or the lock is out of, you can't reach it, it's like, why do you have it? Because you still can't get in, and you don't know how to navigate. You don't know what you're doing. And to your point, you just mentioned something I have never heard of, that people should be able to be accessing or using for their benefit. So it's really interesting that there's so many. I think what my incident taught me, along with what you're talking about, is there's so many players in the healthcare system. And it's not just the doctor and your insurance company. There's all these other folks in the middle that can either help or hinder your process. And I think that organizations like California Black Health Network, the campaign that we're going to talk about in just a second, really are helpful. Like, what am I doing? What am I looking at? Who do I call? How do I talk to my doctor? What happens when stuff goes wrong and I don't like my doctor, or I don't like the decision that was made about my healthcare? So I feel like I'm really grateful. Again, I keep saying this, but really grateful for organizations such as CBHN under your leadership that are really helping to educate us so that we know what we're doing. And just a good segue, can you talk about that campaign? Like, how is that campaign working to help people figure out what they're supposed to do with their healthcare?
Okay, I'll start by talking about how the campaign came to be. And so about 3 years ago or so, the California Healthcare Foundation decided to invest in learning and understanding what is happening with Black Californians when they interact with the healthcare system and what that experience is like. And so it was really in response to what was happening in the summer of 2020. Everything goes back to, the summer of 2020, and really with the Healthcare Foundation having more of a focus on anti-racism right? And making sure that racism in medicine is addressed. And so this was one of the ways that they chose to do that. So understanding what is happening with Black Californians when they interact with the healthcare system and what that experience is like led to a set of recommendations from that research, one of which focuses on health education and improving health literacy and helping people understand how to navigate through the healthcare system and advocate for themselves and really make it work better for them. And so I guess about the same time, we were launching what's called the Health for Life initiative, which is our major initiative to improve health literacy of Black Californians. And so from the very beginning, we wanted to help people, well, first and foremost, really empower our community to be more proactive about their health and well-being, take charge of their health, do whatever they can within their power to prevent diseases from occurring. And definitely, if they are struggling or managing a health condition, how do you prevent disease progression from happening? And so our basic 5 things that we wanted to focus on was helping people understand what their patient rights are. A lot of people don't know there is such a thing as a patient bill of rights, and what that means, what that looks like, what is in it, how do you use that to your advantage, what do you have rights and access to because of it, and then how do you communicate with your healthcare provider, no matter who or what type of provider you're dealing with. And then how do you navigate through the healthcare system? It's very complex. You know, it's like you got to navigate through your insurance. You got to navigate through the emergency room situation if you're in there, or if you have a hospital stay, or even an office-based visit. How do you navigate through all of that? And then how do you advocate for yourself, especially if you or your loved one is faced with a serious health diagnosis or condition? You know, how do you really make sure that you get the health care and attention and support that you need and deserve? And then the last part is, how do you participate in the decision-making for your care and know that you should be at the center of that and really own the power in that dynamic? And so fast forward to, 2.5 years later, after we started doing that, when the Healthcare Foundation came to, want to move forward and implement these recommendations, we were the natural partner in that. We already were fortunate enough to be a grantee partner, but we had already laid the groundwork, so to speak, for the health literacy campaign, which is called How Do I? And that means, how do I, as a person, make the healthcare system work better for me? How do I do whatever it is I need to do to make that happen? How do I file a complaint if I have a bad experience with my healthcare provider, or if my health plan doesn't deliver on its promise of what I'm paying for, with my monthly premium? Where do you go and how do you do that? How do I get a second opinion if I don't really believe that this is, the right thing, or the doctor's telling me, I'm just not feeling it, right? So how do I get a second opinion or find a doctor that works best for me? Even starting with the primary care physician, selecting the right primary care physician for you, who's going to really be your partner and take care of you and be there for the long term. So these are the things that we're answering the questions to. And we started a 5-part webinar series really focused on those 5 things that I talked about, like know your patient rights, communicating with your healthcare provider, navigating through the healthcare system, advocating for yourself. And so we have our last session next month, which is participating in the decision-making for your care. And then at the same time, we're taking this, I was going to say taking it to the streets, but what I mean by that is we're meeting people where they are. And we want to make sure we go to places where people work, shop, eat, pray, and slay. So we're taking the idea of making the healthcare system work better for you to those places and spaces where people do all of that and frequent and know are trusted places for them to be. So we're doing a community conversation series with Black-owned coffee bars called Coffee and Conversations, Black affinity groups or ERG groups at companies. So that's corporate conversations, or with churches in the faith-based community. So that's conversations with the congregation. With Black-owned establishments, we actually have one coming up in Inglewood on November 20th called Cocktails and Conversations. So we do that at a Black-owned restaurant or a wine bar after work hours. And then I feel like I'm missing one. So coffee bars, yes, Black-owned coffee bars. So that's Coffee and Conversations. So we want to make sure that, again, we're in places and spaces that are known and trusted, but also supporting our Black community, when we do these events too, and engaging the community in these conversations. And it's been pretty amazing that people have been very open, sharing their stories about their experiences, either from their own personal experience navigating through the healthcare system or doing that on behalf of a loved one. Even in the webinar series, we don't have live chats, but in the Q&A box, or even in the chat box, I should say, people are not on camera, but they still are sharing things about experiences that they've had with the healthcare system or their healthcare provider, asking great questions. So that tells me that there is definitely a need for this, and people really need to understand how to make the healthcare system work better for them.
Yeah, absolutely. Are there any key findings from those sessions? Have any themes? So you mentioned people are putting stuff in the chat. I'm sure there's a eval at the end. Are there any things or themes that are coming up that people are talking about after these sessions that you're able to share?
Well, I hate to say this, but there's what we hear a lot is people are challenged with one particular healthcare plan. I don't necessarily want to call them out, but sometimes it's about just getting access to annual screenings, like for colonoscopies or breast cancer. And, so we've helped them navigate through that and given them a number to call for that particular healthcare plan, and also a DMHC. So you can call the Department of Managed Healthcare Services and file a complaint with them too. If you've seen anything in the news, you know that there's a major health insurer here in the LA area that, paid the consequences for not necessarily serving patients in the right way, and was held accountable for that. So they shall remain nameless too.
Yeah.
So yes.
I want to too.
So we're hearing a lot about that. We are getting a lot of questions just about lots of different situations. Just, again, just asking, how do I do? What happens if, I'm trying to advocate for a parent, who I'm a caregiver for, and people are telling me you can't make this decision or that decision. But if, having a power of attorney is important, first of all, in making sure that that person has all the medical directives and everything in place. And so some people just don't know, right? So we're providing basic information for people to really know what to do in certain situations. So
very, very important, because I think, unfortunately for a lot of us, and I said this, I think last week, we don't realize our health coverage is bad until it's too late. Or we don't realize, our doctor is a little, until it's, you really need that help. And then it's like, this man or woman or a doctor is not helping me. What is going on? And so you want to be able, to your point, have that knowledge base and that resources and things to know, okay, I'm not going for that. Let me switch health plans. Let me switch from HMO to PPO. Let me call, like you said, the Department of Healthcare Management and file a complaint. Some of us, I'm not going to say a lot of us, some of us are taught, well, the doctor knows best or the health provider knows best. I just, whatever they say, I defer. But we need to be taught, no, we don't have to sit and take what's given to us just because, right? And so I think these sessions are really important. And it's so funny because, like you've said to me, like, Nicole, too bad you didn't, we didn't have these before you fell on a broken ankle, because I probably would have been able to navigate myself out of it. But man, that was a wild journey. But I think, at least for me, similar to what you were talking about on your health journey, this has really opened my eyes and helped me to become a better advocate for people as they're going through their healthcare journey. Because it's like, I don't want nobody to ever break an ankle or any issue and take 104 days to get the help that they need.
Yeah, it shouldn't take that long. No. And then we know sometimes that health insurance dictates the type and quality of care and timeliness of care. I don't know how you answer questions, but I saw something pop up about doula services. And so, doula services are great. And we know that they have definitely help improve birth outcomes in situations, especially for Black birthing people. Unfortunately, doula services are not covered by all types of insurance. Under Medi-Cal, because of the Omnibus Act, now doula services are covered, but not a lot of people really know that. And that information is not always shared with patients who are in their birthing journey. Private insurance generally does not, Medi-Cal does.
Oh, that's interesting. I would have thought private insurance would be open to that, but I guess is it that they haven't caught up yet, or they're just like, we not paying for that? I'm
No,
interested.
it's
I
just,
don't know.
well, I mean, I think if you have certain levels of insurance or more concierge medicine type of coverage or arrangement, then that may be the case. But generally, on average, the private insurance does not typically cover doula services like Medi-Cal does now.
Well, I'm glad Medi-Cal does, because we definitely need that. I had a whole conversation about the historical impact of doulas and midwives, in our lives as Black, birthing folks,
Going back, yeah, to our roots in Africa, yes, yeah.
and then how in this country, again, we was birthing everybody's babies, right? At one point in time, all midwives were on the plantation birthing everybody's babies, everybody, including the owners. But then at some point you can't do that anymore. Have your babies in the hospital. It's better, it's safer. And they kind of, eliminated that whole sort of level of expertise and care. And then our birth outcomes didn't improve. They got worse. And then it was like, oh, shoot, we should probably bring this back. And it's like, yeah, you should have never taken it away. You should have allowed this to continue. We'd be better off. But I'm glad we're back there and we've sort of re-elevated that whole line of work because it's very valuable, especially for our communities. So it was interesting even for me just to read that history around that. I feel like as we kind of wrap up, we're in a different season now, right? A few years ago, I think you even talked about this when George Floyd, COVID, all this money was kind of coming in to nonprofits. There was a lot of funding, but then I feel like we've turned a corner. We have an election coming up. There's one candidate that's a little, not a little bit scary, a lot of bit scary. And I feel like we really have turned the corner in a lot of ways. Why is it important for folks out there, regular people, y'all that are watching this right now? Why is it important for folks like y'all to support orgs like CBHN? Why are those dollars so important?
So I'll go back to even before COVID. So we know even before COVID, there's something called the philanthropy giving gap, which means that Black-led nonprofit organizations typically get about 45% less in terms of philanthropic support than white-led organizations do. I've seen this happen in real life myself. So I say there's disparities and disparities work, right? And then, when the summer of 2020 happened, July, in that time frame, we saw a lot of funders across California, foundations, individuals, and other entities come together to form like the California Black Freedom Fund that wanted to fund Black-led organizations for capacity building and giving core operating support. And unfortunately, all of that funding, while it was great and was very and extremely helpful in helping us sort of cross that chasm, has kind of dwindled. And I kind of anticipated that. So I'd say it was more of a moment in time than a long-term commitment to sustaining the health and financial success of nonprofit organizations. So we have to fill that gap somehow. We write grants, that is a laborious process, but, we serve our community, but it's just like tithing at church, right? People tithe at church because they believe in supporting that community. So tithing to nonprofit organizations helps support the work that we do in our community to really, again, help educate our community about, whether it's the healthcare system or how can they really be more empowered to take just one step at a time in improving their health and be accountable for that for themselves. How do you advocate for yourself in certain situations? Policy work is an important part of our work. And as you know, and I say programs come and go, but policies create lasting change. So we get involved in a lot of policy work so that we can address and dismantle things that happen at the system level that lead to health inequities. And so we need to support myself and my team to do that work so that we can make a significant impact in improving health outcomes and the life and life expectancy of Black Californians. So you can always donate and support. Every dollar counts, no matter how big or small.
Okay, and so if someone right now wants to donate, how do they get to your website? How do they get to the page where they can put the money in there?
Yeah, so you can go to CA, like California abbreviated, CABlackHealthNetwork.org, go to the upper right-hand corner of the screen. You'll see a little donate button. You click on that and it takes you to the page that talks about the work that we're doing for the Campaign for Black Health Equity. You can be part of that. You can donate at whatever level you feel you want to support. And we appreciate whatever support we get. People can always volunteer. We're looking to fill committees. We're looking for volunteers to help us, carry this information forward with the How Do I campaign so that we can continue to have more broad education and reach across the state with this information and message.
Awesome.
Oh, go ahead.
No, go ahead.
I was going to say, yeah. So our messaging around the campaign is we've got the power, right, to make the healthcare system work better for us. And we certainly do. So that is the message that we are going to be carrying forward into next year and throughout the duration of this campaign.
Yeah. Amazing. One of the things I've been thinking about, I'm like, I think I'm going to try to reach out to all my friends and all my family and say, listen, it took 104 days to get treatment and it should not have. Can you support by donating $104 to the California Black Health Network or $10.40? This has just been sitting in my head, thinking about how I'm going to approach my people, ask them to donate and support. Someone says they would like to help remotely in any way I can. So we'll make sure to get your information and get it over to Rhonda so you can support. That'd be great.
Yes. You can email us at info@cablackhealthnetwork.org if you want to reach out, and we'll respond that way. Or I see that she's on LinkedIn. I'm on LinkedIn as Rhonda M. Smith. You can message me through my LinkedIn profile.
Awesome sauce. Or you can reach out to me and I can make sure you get connected. However, whatever makes the most sense, I would love to make sure that you get connected. I actually also have other thoughts. You had talked about an ERG and I'm like, aha, there's one at my job I'm going to try to connect you with. I have her email. She actually emailed me for something else. I'm like, let me go ahead and make that connection. And I think that's something else I'll say before we close. We only have about 2 minutes left now. Think about, you guys that are watching, think about ways that you can connect people, resources, information. You may know someone that has some connections. Think about ways that you can connect those people to these nonprofit organizations like California Black Health Network so that they can have that support. It would be really helpful. So look for me because I'm going to do a campaign. I'm making up my own thing. We're going to the 104 days thing.
Giving Tuesday's coming up in a little more than a month.
Yeah. And that's the opportune time. Y'all just open up your pockets, your wallets, your hearts, and support an organization that is doing such amazing work. Thank you, Rhonda, for being with me tonight. All right, y'all. We will see you next week. I don't even know what we're going to talk about next week because I ain't thought about it yet, but it's November. I'll probably talk about something about being grateful. We'll see. But you all know where to find me. You can check out my website, www.NicoleDVick.com. You can go there and find previous podcast episodes that I have been a guest on. You can purchase my books on that website. If you want to hire me to be a host, to do speaking engagement, there's a contact form there. Someone reached out to me a couple of weeks ago, and I was able to give them some answers and some information. I have books. That's my latest book, Triumph in the Trenches. It is an anthology. I have a chapter in there about the work in public service. So pick that up on my website. And you guys know I have my other 2 books there as well. You can also find me on social media, most likely on LinkedIn these days, sometimes on Instagram. Me and TikTok, we're not friends right now. I'm not really on there much anymore. But you can find me almost anywhere. If you type in Nicole D. Vick, you will see me. Now, there is another Nicole Vick in the Midwest. That ain't me. But the Black Nicole D. Vick, that's me. Okay. All right, you guys. Thank you so much for watching. Rhonda, thank you again for being here and joining me tonight. I will see all of you next week. Bye.
Thank you for watching Pyro Media Network. For more information, please visit pyromedianetwork.com.